Hello and welcome to the second talk in PDF's fourth PD Expert Briefing in this series. Our title today is Caregiving and Parkinson's Disease. As those of you who've joined us before will know, we try to cover in these series some of the most important topics in Parkinson's. We survey the community regularly to see what those are and then distill the responses and try to come up with the best and most relevant subjects and the best people to speak to them. And certainly we've struck lucky today with a terrific presenter on a very important theme. I want to thank, as we go into this session this afternoon, or this afternoon our time, express our gratitude to our two corporate sponsors for this series. One is Abbott Laboratories, and the other is Teva Neuroscience. I also would like to note that this month is National Family Caregivers Month, so it's an auspicious time for this particular lecture, and we're very pleased that we have as media sponsors the National Family Caregivers Association working with us on the event. A couple of announcements to help you get the most out of this. First of all, if you want to find resources for care partners, please do come to our website, which you can find easily in the shortest domain name in the business, www.pdf.org. We have a section on care partners and caregiving, or you can call our helpline, which we encourage you to do, at 800-457-6676. As to professional credentials, I want to alert you, those of you who don't know it and would like to know this, that the course qualifies for continuing education unit credits for several health professional organizations that are made available to us very kindly by the American Society on Aging. In order to take advantage of this, if you haven't already done so, you need to do this in 30 days, within 30 days after today. So if you're interested in getting credit through the American Society on Aging, do please let them know, or if you have any problem with this, call us at the number I gave you, 1-800-457-6676, and ask for Eli Pollard or Valerie Holt, and they will give you any further information that you may need. PDF does many things besides these expert briefings, and we encourage you to come to our website if you'd like to find out what some of those things are. Our educational programs, our programs of research advocacy, and also the scientists we support. A large portion of our money continues to go directly to supporting scientific research in Parkinson's. Now, it's my huge pleasure to introduce our guest speaker, authority on the subject, and a person I've had the enormous personal pleasure of getting to know over the years. Just a terrific person in our field, Miss Julie Carter. Julie is a professor of neurology at Oregon Health and Science University. She has this interesting series of letters after her name in the nursing area, and I just learned when I questioned her that the university was sufficiently impressed with her at the highest level that they invited her to become, quite recently I think it was, a professor of neurology, which says a lot for Julie, but in my view it also says a lot for them, recognizing the enormous professional stature that she's achieved and how that fits within the neurology space. So Julie is really a very accomplished person. She is dedicated to improving the lives of people and their families who have Parkinson's disease. She developed a model of family-centered interdisciplinary care for the Parkinson Center of Oregon and has been involved in program development at all sorts of levels. The center of her research focus is family caregiving and Parkinson's disease, which is the subject of today's talk. And she realized very early on how important families are in the delivery of care to people who really have what has to be described as a family-centered disease. Parkinson's is never something that you have by itself or by yourself. It inevitably and invariably involves the context of family, often community, and people beyond. And Julie has devoted much of her work in her distinguished career to studying that. She's looked at the issue of strain on caregivers, something which many people on this call would not need to be told about, across stages of the disease, as well as the predictors of how that strain can develop longitudinally, in other words, over time. One particular aspect of her interest has been the very poignant and very delicate and very important subject of how you best talk about the diagnosis of Parkinson's disease as a physician or as an RN or other health professional in the office setting when a person is diagnosed. And that's been a focus of her work. So, Julie, it's lovely to have you. Welcome to our expert briefings, and the floor is yours. Right after Julie speaks, I think many of you know this drill already, we will be distilling during the course of her talk email messages that you're sending to us real time. Please, don't be bashful. Send us your messages. Eli and Valerie will be distilling them, passing them on to me, and to the extent the time allows, we will have a time for me to ask the questions from your written. We don't have the two-way communication, unfortunately, so we can't have you talk, but you will hear your questions articulated by me, and then Julie will answer them. And if we don't get to all of them by 2 or 2:05 Eastern Time, then we will make sure that we get back to you later. So, Julie, thank you for coming, and we're all ears.
Thank you, Robin, and hello to everybody out there. I must thank Robin and the PDF and Eli for this opportunity to personally get to recognize and honor all of you who are in the role of caregivers. It is such an important role and integral to the health and both emotional and physical of people with Parkinson's disease. And yet your health, both emotional and physical, is also at risk by simply being in this role. And I think there are things that we can do to help you and support you in this very important job that you find yourselves in. And that's what I hope to offer you today. Some of my ideas that I have gained over several decades of taking care of people and their families with Parkinson's disease. So I'd like to start with just a few numbers about who you are. These numbers were compiled by the National Alliance for Caregiving in 2009, and I think it's quite interesting that it's estimated that there are over 44 million caregivers in the United States over the age of 18 that actually provide unpaid care to another adult. That's a lot of unpaid work. And on average, when they looked at the number of hours that were provided per week, on average, people have essentially a half-time job of unpaid care. And that 17% of those people actually provide more than 40 hours a week or more a week, so really more than a full-time job. This is very commonly understood, but most caregivers are women. Female caregivers actually report more emotional stress than men do, and there are several theories about that, which we could discuss later if you're interested. When they asked people what their 3 most important unmet needs were, one was finding time for oneself. The second one was knowing how to cope with the emotional and physical stress of caregiving. And the third was balancing work and family responsibilities. So how do Parkinson's caregivers compare to other caregivers? Typically they're older, and this may be reflected by the fact that this is a diagnosis that's made at an older age. They also caregive longer, and that may be because this disease is a disease that can actually span a number of decades. Typically they're a spouse, and compared to other caregivers, they actually have higher rates of depression and other physical problems, which I want to talk a little bit more about. I think it's very important to understand how stress affects the body and the mind. So it's really that mind-body connection that we've heard about. And there's been a lot of work done in this area, and I think, these articles like Newsweek, how stress attacks your body, we see scientific articles about the impact of stress in all kinds of publications. When the work that's been done in caregiving specifically, we've seen that caregivers actually have more visits to the ER, more heart disease, higher blood pressure, more sleep deprivation, and this is this is measured in a sleep laboratory as well as reported. And I think an interesting side issue is that when you look at cognitive function in caregivers, so how they think and problem solve and remember things, those are decreased compared to non-caregivers. And this has been associated with sleep deprivation. The other thing is that there's altered immune function. So people who caregive are at greater risk of infections and colds, poor wound healing. The other, I think, interesting or important thing to recognize is that people who are caregiving have chronically elevated cortisol, which is a stress hormone. And if we're in an acute situation, sort of the fight and flight response that we need to, as a preventative and ability to protect ourselves and achieve something like performance on a test or something like that, cortisol shoots up. But when it's chronically elevated and doesn't come back down again, it actually can be toxic to cells. And there's been this research in what's called telomere physiology, which is related to this. And telomeres are, for sort of in a descriptive way, are little caps, protective caps of DNA that are on the ends of chromosomes. And there's a length to these telomeres, so they can actually measure the length. And as people age, they get shorter and shorter. In situations where people we're under a lot of stress, and this has been shown in caregivers, the telomere length actually decreases, which in essence sets them up for rapid aging or shorter life expectancy. And there's been a lot of interesting work in how to protect telomere length and through a variety of strategies. And then, of course, the psychological health issues of depression, anxiety, and grief are more prominent in caregivers than non-caregivers. So now that I've given you all this negative information, please don't go away yet, because I actually think I have something to offer you that can help you with the stress that you feel. I think it's important to recognize the impact that stress has on our health before we can really be motivated sometimes to address this in a very intentional way. The first thing I'd like to say is just to report what are some of the signs of stress that you would experience. And one of the things that I have been doing over the last couple of years, and currently I'm doing this with a psychologist, is to run a workshop for caregivers called the Mindset of Healthy Caregiving. And it's a 10-week workshop, and we really focus on strategies to learn how to cope with stress. And so one of the things is and I'm always amazed at how often caregivers don't really recognize their own signs of stress. So I've just listed some of them. People feel when they're exhausted all the time, angry, frustrated, resentful, feeling more irritable, sad, lonely, feeling like they're sleep deprived. Even sometimes when they're not, they feel sleep deprived, have panic attacks, feel depressed, more anxious, actually develop things like ulcers and colds and other physical complaints. Those are all signs of stress. And if they're not addressed and remain chronic and mount over time, it actually can result in caregiver burnout, which is in essence total despair. So the first thing that we have people do, and it's something that you can do too, is we just give people these little diaries, and we ask them to choose one of the emotions that they are most concerned about in themselves. And these are just times of day. These are just 3 different conditions, sort of when you're feeling good, you're not really feeling this, sort of neutral, maybe some, maybe not a lot, and then when you're actually feeling this particular symptom. And then what's really important is to make notes about what are the surrounding things that are happening when you feel this. as an example, one of the caregivers in our program, she told me that she always felt irritable, no matter, she just felt, and she felt so badly about it, that she was so short with her beloved husband, and she always felt irritable. When she tracked that particular emotion, she was quite amazed at one fact. She didn't always feel irritable, but she was able to start identifying some of the triggers for being irritable when she had 3 things to do at once, when she was trying to get someplace and her spouse was just not obviously on her same pace and wasn't getting going, or when she was sleep deprived. And when she started looking at the triggers, she really had something to work with in terms of making a difference. One of the things that I think I'd like to frame all this in is what I call a self-care toolbox. And this may sound sort of, it may not sound very authentic, but I like the symbolism of it, because to me what a toolbox is something that you have that you can open up and you can get it inside and take things that you've put in there to help yourself. So I like the symbolism of a self-care toolbox. Now, many people are out there probably thinking, yeah, it's easy for her to sit there and think about, say, it's important for me to do this and that. Quite frankly, between doctor's appointments, running errands, managing medication, doing physical care, grocery shopping, food prep, and the list goes on and on, I don't have time to do this. And let me just say to you that even though I never can say that I have been in your shoes in terms of day-to-day care, the one thing that I think I can respond to is that as a clinician taking care of chronic neurologic degenerative disease for decades, I recognized early on that it wasn't fair for anybody to have an exhausted, lonely, resentful clinician. And because of that, taking care of myself allowed me to continue to be compassionate and caring, which I think anybody with Parkinson's disease deserves from their healthcare provider. And so I would challenge you that the same thing is true for your relatives that you're taking care of. It's not a selfish act to take care of yourself, because it is rejuvenating, and it really allows you to retain the act of genuine giving. So with that, I'd like to start with this concept of self-compassion. And this is truly something that's been measured and researched. The pioneer in this field her name is Christine Neff, N-E-F-F, and she's actually looked at it in relationship to other traits. And basically, self-compassion is really how kindly we treat ourselves in the face of failures sometimes or inadequacies. And my clinical experience with many caregivers is that they are so very hard on themselves. And the role of caregiving may be one of the hardest jobs a person could ever have. And coupled with that, none of us are perfect human beings. So I really encourage people to try to practice the art of self-compassion. And in essence, it's treating yourself the way you would treat somebody who's a friend that came to you and with some sort of concern or problem, and you'd listen to them compassionately. You would extend to them your own feelings of support and non-judgmental comments, and really recognize and help them see that they're not alone, that there are other people that are feeling the same thing they're feeling. So please think about treating yourself with the same kind of kindness, because it's been well shown that self-compassion is not really a act of self-pity or self-indulgence, but it really is connected to a better life satisfaction, optimism, curiosity, and it allows people to actually move forward with the things they need to do in caring for themselves. So I'm just going to now talk to you about some potential things to put in your self-care toolbox. One of those is looking very critically at your own network of support and where you get it and how to get it. It's been well shown that people who have good social networks of support do better in any situation that has adversity. I actually separate these into informal and formal kinds of support. Informal kinds of support are things like support groups, and caregiver support groups are particularly helpful. And some people worry they're just, one of the male caregivers I take care of said they're just a session where people get together and whine. And then he started going for a while, and he recognized that it was much, much different than that. Yes, people express their emotions, but there's also a lot of problem solving that can go on. Obviously, friends and families. But the issue for many people is that they don't want to burden anybody, so they don't want to ask for help. And I'd like to tell you just one story of a dear friend of mine. Her husband was diagnosed actually with a terminal condition that was going to last several years. And when at the beginning of his diagnosis, a number of people said to her, you know, what can I do to help? And her response was, you know, I don't know right now, but I would really like to write down your name, and when the time comes, I would love to be able to call you. And she did. And she received more support than anybody I've ever experienced because of that act. And people loved being able to help her. Most people want to help, they just simply don't know what to do. So learn how to ask for help. The second is formal support, and this usually comes under the category of paid help. I encourage caregivers to look at the things that mean the most to them in their activities of care and focus on those activities and try to hire out some of the things that are lower on the priority list. One of the things that should be high on the priority list is the meaningful time you spend with your care recipient. Often that gets relegated to non-essential when it is really the heart and soul of your relationship. I also really encourage people to guilt-free schedule respite time. It is so rejuvenating. It allows you to come back filled with new energy to do the job that you are doing on a daily and hourly basis. And also financial help. This is critical for people. I often employ a social worker to help with this. There's the area agencies on aging that can be helpful, and a variety of resources that can be supportive in terms of financial strain. The next tool is about communication. Of all the things that I value most in relationships, in all kinds of relationships, is communication. And the first step is to handle your feelings. Finding a way to express your emotions has to be done before you can move forward with really effective communication with your spouse or your partner and those around you. I have a low threshold for getting people into a counseling situation to help express their emotions. Certainly other caregivers, no one knows better than someone who's walked in your shoes. Trusted friends, people who have known you from the beginning of time and now through something that's more difficult. I was one of the sessions in a workshop I gave was to teach people how to journal about their emotions, and this was more powerful than I even anticipated. Writing something down can be extremely, extremely therapeutic. And then there are people who find art a great expression of emotion and use creative outlet as a means of expressing themselves. Once you've done this, I think your ability to communicate with your spouse becomes less charged and more meaningful. Communicating with somebody that has Parkinson's disease is different than the way you used to communicate. And some of that is because the nonverbal expressions of communication are changed. People have less facial expression. Their voice is more monotone and doesn't have the emotional quotient that you've known before. They have sometimes slower response time in their communication, and also just gestures are less spontaneous. And it's so very easy, even in the person you have loved and known your whole life, to make assumptions about what they are feeling and thinking. So I encourage you to use the normal strategies of communication that have been reported every place, but to really be intentional about those. Sit down and really look at the person you're talking to. Check in with them about when you ask them something, if what they really mean by what they're saying. Inquire about how they're feeling, and don't be afraid to tell them how you're feeling in a way that's constructive and that you can really work with. Again, I can't emphasize enough, even though you're in the caregiving role, your relationship is still one of reciprocity, and you both have something to give and to take. I have to add in something here about communicating with your healthcare team or providers. It is so, so helpful to have a caregiver who is a good communicator when you're in the healthcare provider role. Someone who's a good observer, who writes down their questions and is very organized. There is so much more that we can offer by that kind of communication, and it's so much easier to be caring and compassionate when we have good information to work with. The next tool is learning how to be optimistic. I can't tell you how many people say to me, "Well, Julie, that's all good and well, but honestly, I'm kind of a pessimist." And I'm just here to tell you that we all harbor some degree of optimism and some degree of pessimism, and clearly some people are more lopsided in one area or the other. But everybody can learn optimism. And these publications like this Time magazine in just in 2012 is really utilizing these principles of learned optimism. These were pioneered by psychologist Martin Seligman, and he's done a lot. He's actually written a book and done a lot to train people in how to become more optimistic. And in essence, it's really about just changing attitudes. There are a variety of techniques. In our workshop, we actually teach some of this. There's the ABC model. There is the ACT model, ACT. There's CBT, cognitive behavioral therapy. All of those are based on this principle that you can't really change the situation you're in, but you really do have control about how you think about it. Because how you think about something changes the way you feel about that, and the way you feel actually changes the way you behave. And that's a negative feedback, or it's a negative or positive feedback loop, because if you feel a certain way, then you start acting a certain way. And I can give you many examples of this to illustrate it, but for lack of time, unless you have a question about this, I will just tell you that this is something that would benefit you greatly. We're not trying to get people to be unrealistic or look through rose-colored glasses, but many people make assumptions about situations that they truly have no evidence for, and that can be a negative assumption rather than a positive assumption, and could change their behavior in a negative way rather than a positive way. The next tool that I would like to suggest is how to be a flexible and creative problem solver. I can say that over the years of working with caregivers, it is one of the greatest, most powerful tools that a person can have. It is so very easy, especially in a busy time, in a hectic time, to do the same thing over and over again and not really realize when it's no longer working. When you suddenly or gradually are aware that something isn't working, I encourage you to step back and really look at the situation, and which is, in essence, gathering information and really identifying what the problem is. And once you identify the problem, consciously think of different things you might do about it, and then try them on. And it's always surprising to people that when they try something, it actually is better than what they've always done. Even though what they used to do worked, it no longer works. So be a creative problem solver. Be flexible. Recognize that what's important is where you are today, not where you used to be, and it's a key for happiness and also a key for decreasing stress. And finally, and this is something you've heard many times and sounds trite, but treating yourself with care, it is simply not a luxury. It's not selfish. It allows you to, when you take time for yourself, if any of you can relate to this, you really rediscover sort of the purpose and meaning in your life that brings you some sort of happiness. And it allows you to replenish the care and love that you have for the thing that you're doing or the person you're caring for. And it adds depth to your care because you bring new things to the interaction. And it also can improve your health. So a few ideas about what that means. Many people say, okay, fine, but how do I do this? And one of the exercises that I think is always very enlightening, remember I was telling you how to track negative emotion. I ask people to, first of all, look at a list of pleasurable activities. It's just a long list. And to identify some that they actually relate to in terms of a pleasurable activity. And then, or something that they do occasionally. And then they track, again, when they do it and how they feel when they're doing that particular pleasurable activity. It's very revealing because pleasurable activities to many people are equated with something that's superfluous, that and be the first thing to go when the going gets tough or when life gets particularly busy. But what they see is how therapeutic a pleasurable activity is. And when you can elevate something like that to a level of meaning, it can be as simple as one caregiver talked to me about how the sort of the ritual of making a cup of coffee in the morning, and the smell of the beans, the choice of coffee beans that she made. She was quite a coffee connoisseur. The cup she chose, the warmth, the moment she spent because it was a moment by herself. It was a true ritual, and it became actual ritual of meaning for her. Of course, exercise. I have one spouse caregiver who he actually brings in somebody to stay with his wife 3 days a week for 2 hours so he can simply exercise, and recognizes how much it gives him by doing that. There are all kinds of relaxation techniques, and they work. There's deep breathing. There's different kinds of meditation. There's relaxation therapies that allow you to learn to relax your muscles. All of these can be brought into play at any moment in time and provide true, genuine psychological benefit and actually health benefit. I can't say enough about time with positive friends, people who make you smile and help you see the positive things in life and give you a sense of community. Humor, there's nothing more, our muscles aren't tense when we laugh, and it's like putting a little cushion around hard things when we can find things to laugh about. And of course, I've mentioned asking for help. So in closing, I really encourage you to take charge of your life. You may not be ready, but if you are, and some people aren't ready for change, but even if you feel like I want to change, but I really don't know how. You're the person that can make a change today. You can alter your life truly by altering your attitude, and you encourage you to focus on the things that you can control. There are things you can't control, and you just have to let those go. Again, treat yourself with the same care that you treat others, and remember that in the middle of difficulty, there often are opportunities, and not to be, again, looking through rose-colored glasses, but there are gifts. Many people tell me about some of the people they met that they would have never known if they hadn't been in the world of Parkinson's disease. And finally, I want to offer you some web resources. I've looked at all of these. They're all really designed specifically for caregivers, and they're all very useful, as well as their caregiving resources from all the national Parkinson's foundations. PDF has some very specific ones, the fact sheet, the resource list, and then there's their expert briefings. So finally, I want to just thank you all for all that you do. I'm very honored to be able to talk to you on Parkinson's Caregiver Month. You are needed and appreciated, and again, thank you.
Thank you, Julie. That was just wonderful, very authoritative, but also very tender and compassionate and thoughtful, and we appreciate all of that. For those of you on the phone, on the call, there's still some time to ask your questions. We've got quite a few very good ones already, but if you care to send us a question, you can continue to do that through the entire session. What you do is you look for the text messaging feature in the lower left-hand corner of your viewer page and simply click in the box below, enter your question, and click on send. And if we have time to ask it, we will. We got, as I said, quite a number of very good questions before us. Even though Julie covered the ground terrifically, there's still parts of the ground that people feel they could have some further attention on. So let's raise a few of these. This question from Alberta, it's the province of Alberta in Canada. Our friend there would like you to comment, Julie, about whether, when there are other Parkinsonian conditions involved, sometimes called Parkinson's plus, and the diagnosis is one of those, are there any particular tips on how the caregiver challenges may be different for those, or is the caregiver job pretty much the same, whatever kind of, whichever one of these syndromes you're dealing with?
Okay, that's a good question. So the Parkinson's plus syndromes are, for those of you who may not use that term, that's like MSA, multiple system atrophy, or PSP. There are some others, but those are the two most dominant ones, and these are very rare to start with. The issues are somewhat different in that symptoms are changing more rapidly. And the disease itself is more aggressive, and the duration of the disease is shorter than it is in idiopathic Parkinson's disease. So it makes so much of caregiving is dealing with issues of dependency and knowing how to, at the same time, find a balance and care for yourself. So I think that some of the differences are symptom specific. In PSP, the communication becomes more difficult because speaking is more difficult in PSP. It can also be true in MSA. I think that so it's different in terms of some of the symptoms you're dealing with, and that's a whole talk into itself. I think that in terms of care, you should. I think you are the group of people who could benefit most from some paid care in your home, so that you have time to spend the sort of care you need with your partner and with yourself.
Thank you, Julie. Some of these questions, you will quickly note, are really very direct, and they come from a point of pain and anxiety. And if you'll forgive me an editorial comment here, I think it is lovely that those of you who raise these points trust us with them, because clearly this is where Julie can exercise those many years of experience, and I'm sure that they will resonate with many people who may be also on the call. This friend of ours from Michigan tells us that she has a very special challenge where her husband has Parkinson's disease and dementia. It includes dementia. And she's asking two kinds of questions. One is when she should stop inviting him to social events, which she says, with obviously great pain, would mean the end of her own social life. And what kind of advice would you have for her, Julie, in managing this particularly difficult kind of challenge?
Well, first of all, believe me, I actually can feel your I feel your loss. I mean, it's one of the issues that is sometimes under discussed in Parkinson's disease is loss of that meaningful relationship that you have with your spouse, and that's particularly pointed in the picture of dementia. That person that you've shared so much with no longer is the same person, and yet they're still there. And what I would say to that is I think you should be picky about your choices of social interactions. There are places to invite your spouse to come because that would be a situation where there are trusted friends that would understand. And I see people doing this in spite of very, very frank dementia. But I would really, really encourage you to not let your social life be completely dictated by the places you can go as a twosome. People who are caregiving and also are taking care of somebody with dementia need to develop some of their own social outlets. It's very supportive, very rejuvenating, and you need that, and you deserve that, and should not feel guilty about it. It usually requires getting somebody to come and take care of the person, obviously, so there's some management issues around that, but please don't give up your social life entirely. You deserve it, and you shouldn't feel guilty. You should actually feel smart that you do that.
Thank you, Julie. This next one is a little more straightforward. It is from a friend of ours in New York, and she is asking if the wellness checklist, I believe you have one in your slides, so it's a little hard from where we're standing here to read all of the stuff in that. Is there a checklist, Julie, for the caregiver stress tracking that you could also make available? I believe a couple of people have asked this question, and we wonder if there's an easy way to get a checklist for caregiver stress tracking.
Oh, you mean that little diary that in the...
Yes.
Okay.
Yes.
Sure. I'm happy to send that to you.
Okay. That'd be great. So if you send it to us through us, we will then distribute it to those who are interested in that particular question. Thank you very much.
Let me just tell you, though, I'm going to go back to that for a minute so you can look...
Please.
So you could... I will send it, but I also want you to see how simple it would be to make it yourself. You just put the date. You can actually put the symptom you want to look at. So then just times of the day. And then just 3 categories where you're looking, do you not feel this? Do you sort of feel it, or do you really feel it? And then notes about what are the triggers around those feelings. Like if it's fatigue, when do you feel fatigued, or when do you feel not fatigued, and you start seeing this pattern. So if you don't want to wait for the form to come, I think you can easily make one yourself, but I'll very happily send it to Robin.
Thank you very much. This next question I took the liberty of elaborating on a bit. It's from Grand Rapids, Michigan, and the person was asking about any tips you might have for diet in caregiving. And I'm adding what's often a companion to diet when we're talking about self-help and self-therapy, which is, of course, exercise. And the question is, any advice you may have, Julie, on diet and exercise in connection with relieving stress?
So One of the things, this is a really important question and such a big question. So first of all, diet. I would like to start with the premise that we underestimate the value of good nutrition, and we don't even sometimes know what good nutrition is. We think we're eating a good diet when, in fact, we're really not eating a good diet. You're doing so many things on a daily basis, and yet, so it's hard to be intentional about a good diet. But it really makes a difference how healthy your food intake is in terms of how much energy you have. So and there's not like a special diet for stress, but one thing I can honestly tell you that having having the balance that you know a lot about, which is about good vegetables and fruit, and it sounds very trite, but it's so real, and protein that's interspersed kind of throughout the day so you don't get these big swings of blood sugar can be very, very helpful. The two things that I see caregivers, if I can say succumbing to, easily, and I understand this because stress does this. One is sugar, and the other is alcohol. This is again something you can track. I actually tried this in myself. I tracked how much sugar I ate, and it was quite remarkable how much more I was eating than I actually thought I was eating. And when I reduced that, didn't mean I gave it away altogether, but I felt so much better. So trying to be intentional about a good diet, and that means planning ahead because we're in the heart of the moment. It's really hard, and you're hungry. It's hard to always eat good food. And then setting some goals for how much alcohol you're going to consume in a week or a month or whatever it is, and trying to really monitor your alcohol consumption. It's easy to drink more than you actually want to even. I think it's important to take a multivitamin because I usually don't always advocate this, but I think it is important because it is a source of important vitamins and minerals that sometimes you don't get in your diet when you're so very busy. Then exercise. It is so rejuvenating. It's good for your brain. It's good for your mood, and it's good for your body. So, and people say, I just don't have time to exercise. And I understand that. You really have to set up a plan for yourself and figure out what it is that will motivate you. It might be finding another group of friends that you are responsible to meet, or so that you have to keep that appointment like you would any other appointment on your calendar. Just do something you love. It may be walking and looking at nature. It may be going to the gym and exercising there. It may be being in a class. Just find something that you do at least 3 times a week, even for 20 minutes. You may even just go into another room of your house and do something. But do exercise. It will make a big difference in your well-being.
Thank you, Julie. This next question, I think you'll agree with me, is really a generic question and a powerful one that crosses all of our lives. And it's a person with Parkinson's who describes himself as a husband. He's in Maryland, lives in Maryland, and his question is, from the perspective of a person who's living with this condition, how can he make life easier for his caregiver, his beloved wife, and what she does for him? In a sense, all of this is a mirror of what you've already told us, Julie, but is there any particular piece that you might pick out and say that if you're talking to somebody with Parkinson's, how can they be more caring, more sensitive, and more helpful to those who are taking care of them?
Well, first of all, thank you for asking this question. It is obviously one that many people with Parkinson's disease feel, and it's so sensitive and so caring from someone with PD. And so many people who have Parkinson's disease recognize how much their partner is doing for them. So thank you very much for asking this out loud. So I think gratitude on either side of the equation is worth so much. And telling, and you're probably a person who already does this, but telling somebody, telling the person that you live with how grateful you are and be specific about certain things they do for you. I think encouraging, many caregivers harbor so much guilt because they are, quote, well, and their beloved spouse is the one who has this disease that nobody wishes they had. And so they feel that guilt makes them feel like they don't sometimes deserve what they would view as self-indulgent kinds of activities. But encourage them to have a life of their own, just like you would if you didn't have Parkinson's disease. That's one of the greatest gifts that you can give them. And then just shared time that you initiate, and also affection. I had one caregiver tell me whose husband was quite demented, that every morning he came over and he gave her a huge hug, and that was one of the most meaningful parts of her day. So that's a short list, and there's obviously could be many, many more things to say.
That's wonderful. Thank you very much, Julie. This next question, a very different order, of great interest to PDF, where we spent a lot of our time thinking about research in the various areas of Parkinson's. This person from Mount Kisco would like to know about research studies that involve caregivers, and whether you, and perhaps he's also asking PDF too, we should go and scurry around and see what we know about this, well, how you would advise, Julie, somebody who wants to have their experience used as part in a research setting where they could be helping understand caregiving in Parkinson's by contributing information on their own particular situation and challenge. Do you know of any such studies, top of your head? Do you have any advice as to where somebody might go to find as a source of information on ongoing studies of this kind?
Let's see. I don't have a very specific list. There are a number of studies. There are lots of studies in Parkinson's disease and caregiving that have been published. I'm trying to think of an active study where they're recruiting people right now. I don't really know. I can't give you a very specific information, but some of those websites, let's look at those. I know some of these, you might visit some of these and see if there's any research component to them. The Rosalind Carter Caregiver Foundation, which isn't on here, is they actually give grants to different people that are some of them are research grants. So that's another avenue to explore. I guess that's about as much as I can say. I'm not able to give you some very specific ongoing studies that are looking for participants at the moment.
Thank you, and we will take some of the responsibility there. We will see what we can find and respond to that person, and also to anybody else who's interested in this. We do have some people in my office who I know quite a lot about this area, and I will tap their experience and expertise on that. The question, I'm combining two here that I think, again, represent a sort of a broader swath of questions. A person from New York who is concerned about well-meaning friends who really don't understand Parkinson's but are always ready to give her advice. And then another correspondent from Massachusetts who has exactly the same problem but with her stepdaughters who live at a distance, and they know everything about what's best for their father, and often send the caregiver messages about what she should do about this and that. In each case, but in different circumstances, you have a situation in which well-meaning and involved outsiders are the experts, and the caregiver, in addition to the burdens they're carrying in the caregiving, also have to put up with this barrage of expert advice from outside. How, Julie, would you advise the caregiver to handle this kind of thing tactfully and helpfully?
Oh, yes, this is a common problem. I'm sure many people out there can relate to this. There you are in the heat of the moment, and somebody else comes in and tells you exactly how you should do it better and differently. We used to call those seagulls. They swoop in, they stir up a little trash, and they swoop away. But actually, people, so there are two things you've talked about. One is about people who, are just, they genuinely are not trying to tell you how to do it, but they have all this information. They've read the latest article. They've done it. What about this? What about that? What about this? So there are those people, and those people are just sort of trying to help you. And I think my advice is to thank them. You can even instruct them a little bit. I really appreciate what you're doing. I really trust my clinician, my healthcare provider, and we've got a plan going right now, and I really want to follow that. So there's that. Then there's the people who are relatives, who are the long-term caregivers, who feel they wish they could do more, and all they can think to do is instruct you how to do it better. And I think you have to just tell them how it makes you feel, and tell them that I'm doing the best that I know how to do, and I know that probably from afar it looks like I could be doing more or something better. But honestly, all I can do is the best I can do. And when you suggest these things, it makes me feel inadequate, or it makes me feel whatever it makes you feel. So describe how you feel rather than respond with anger or frustration or whatever it is that's less constructive. And try, I know it's not always possible, but try to have a conversation with those people about that, what you're doing and how it makes you feel. And if they would like to help, one of the things they might be able to do is support you rather than think about things that you should do.
Thank you very much, Julie. It's very, very thoughtful. We're coming to the end of our time. We will be running a few minutes over for those of you who can spare the time with us. Forgive us for this, but a lot of very rich questions coming in. And there's one in particular, which our producer across the table from me tells me several people have asked this question in various ways. And it has to do with communications. The caregiver who has been doing this work for goodness knows how long, years often, who finds that the person they're caring for, typically a spouse, could be somebody else, is simply unable to communicate their needs, cannot talk as they used to be able to, and doesn't have other means of communications that could help compensate for that. And it just adds, in the cases we're seeing here, immeasurably to the frustration and the difficulty of the caregiving process. Before I ask Julie to comment on this, I want to draw your attention. The same brilliant producer has found for us a very good talk we had a couple of years ago, specifically November 30th, 2010, by I'm not sure what these letters stand for. It's an RN, registered nurse with a few other degrees too. Her name is Teresa De Sheffi-Longi, and she gave us a terrific session at that time on the subject, what's missing, communication, and the PD partnership. And so those several people who've expressed this question to us, please go to our archives through the PDF website, www.pdf.org, and look for the De Sheffi-Longi talk, which was on November 30th, 2010, again, part of the expert briefings, and I think you'll find that helpful. So, Julie, with that wordy preamble, do you have any comforting and thoughtful and sage notes to make about people who are worried about their spouse's communication skills?
Yes, I just like to put communication into sort of two big categories. One, what I said in my talk was really trying to enhance the communication that truly gets it gets negated sometimes by when you really could communicate more effectively than you're doing. So that requires somebody with some cognitive and communication skills that still are present. But in busy lives, people forget to talk. They forget to communicate, and that is what I, in my talk, was encouraging you to try to bring to your consciousness. This other situation where people can no longer communicate through dementia or because of speech difficulties, that is a different category, and with that obviously comes a lot of loss and sadness about the loss of the person that has been your partner for often many years. In that situation, I encourage you to, I can only share a few stories and experiences, and one is a woman who had actually a Parkinson's variant and could no longer speak and was struggling so very hard, and her family members were struggling hard. And this was so simple, but they just encouraged her to do a thumbs up, thumbs down. It was that simple when they asked her a question. And she went they had no system for communication. And that small little thing made a big difference. I think that the other, so asking, do you want something to drink? Thumbs up, thumbs down. Do you need to go to the bathroom? Sometimes it's at that level. Another idea is I've often utilized our augmentative communication specialist, who has a variety of electronic kinds of devices that are really amazing, especially things that fit on the phone, et cetera, that can be very, very helpful when communication is altered because of physical and cognitive symptoms. And finally, I can't emphasize enough just touch. I mean, this doesn't allow them to communicate what they need to you, but it does communicate something to them no matter what their other symptoms might be.
Thank you very much, Julie. I'm going to just have one more question. Before I get to that, I want to just let you a couple of little public service announcements here. First of all, the Expert Briefing survey should be up on your screens, those of you who have the computers in front of you. Please, please, please fill this out for us. It doesn't take more than a few minutes. We make very, very good use of this. In fact, it's our single most important device in planning future sessions. So please tell us, frankly, what you thought of this, any suggestions you have. It doesn't take long to complete, and we'd love to have something as close to 100% as possible. So look at that survey and please complete it. One more public service announcement on resources. So there have been several questions about Julie's talk itself, and please know that you can download the slides. Actually, from now on, they're up there already on the website. Download the complete series of slides or any piece of it you wish on pdf.org, so you can review what you've heard and study the details of it. The last question, Julie, I'd like to take your time on is also combining 2 or 3 different questions we have, one from Indiana, one from Ohio, and it has to do with what I would call, I hope it's the right word, the matter of compliance. When the person with Parkinson's, in the hands of this very attentive and loving caregiver, doesn't do what the caregiver thinks he or she should be doing. And one of the examples was simply medication prescriptions, not following the rules there and being difficult and ornery when it comes to taking medicines. And another one which had to do with speech therapy and gait therapy. The caregiver would take the spouse dutifully for these sessions every week. The husband apparently goes to them and then doesn't use the tools at home, and that deeply frustrates the caregiver. So both of those are sort of in the general area of compliance, doing what is good for us, and the caregiver being frustrated when the person with Parkinson's doesn't see it quite the way he or she does. Do you have any advice on the matter of encouraging compliance by the caregiver to the patient?
Well, so this is. First of all, isn't it frustrating when somebody doesn't do what you know is best for them, or at least you think is best for them? And I so appreciate the emotion that comes with that. I think that at some point you have to recognize that some people are not going to change. And more than that, the moment you tell them what they should do is that it encourages them to dig their heels in even more. And it, in some ways, is their only way of controlling their life. So that's one way to frame it. But one of the this is actually needs to be very individually based, and the people involved, many of their individual conditions need to be taken into consideration. So I'm going to make the assumption that this person is not demented, but simply won't do what they're supposed to do. And I sometimes will employ a psychologist or myself in these situations with the person rather than the spouse being the nag, as they feel, which is the word they use for themselves. Being a nag is one of the worst feelings you can have, and also very destructive for relationships. So at some point, you can't always be the policeman, and you just need to let go. You need to do the best you can, but I want to also give you permission to recognize that sometimes you can't change somebody. But what you can do is employ the use of a professional to really work with that person in identifying why they don't want to help themselves. What would it take within their, I always ask people, so what would it take to get you to exercise at least twice a day? And some people tell me, I'm not going to. And that's a person I know I will not change. Some people say, well, I've got this problem and that problem, and they have they're obviously ambivalent, and they have some reasons that they don't, but they're also sort of interested and maybe they should. That's a person you can move forward into setting up a plan for themselves to follow. And I do this with drug management too, really exploring the reasons why people don't take their pills on time and trying to have them be part of coming up with ideas that would work for them. And I find that when people come up with their own solutions, they're so much more compliant, not maybe perfect, but more compliant than when it's somebody else telling them what they're supposed to do. I hope that's helpful. That's a very frustrating feeling when you're working so hard to do a good job as a caregiver.
Well, it certainly sounded helpful to me, and I'm sure it did to all of our other visitors to this call. By the way, Ms. Carter, we have a total of 358 people signed on to this, so you had a good audience and certainly a very attentive one, and I want to compliment you all and thank you all for your excellent questions. It's our time to close, a few minutes late, so forgive us. Of course.
Can I just say one thing? For
Please.
Those of you in the Northwest, I want to invite you to a caregiver symposium that we put on every year, and this one will be May 2013, and it's going to be on, I'm sorry, I've got to get the date up here, the 16th, which is a Thursday, early evening. And you can visit our website at Oregon Health Sciences University if you're listening from the Northwest. Thank you, Robin, for letting me.
Thank you very much. And if you missed that or want to catch up with it and you can't reach Julie, please do email or call us. So it's time to conclude. I want to reiterate our thanks on behalf of the Parkinson Disease Foundation to our venerated sponsors, corporate sponsors. One is Abbott Laboratories. I understand we have a senior staff member from there. I won't out him, but I know he's on the line, and I hope he enjoyed this as much, certainly, as we all did. Teva Neuroscience, and also our media partner in this case for this particular very special event, National Family Caregivers Association. We're very grateful to them all. As I hope you all know, they provide the support very respectfully and step aside. The editorial content of all of these is entirely independent of our sponsors. They respect that, and we respect them for feeling that way. So we're very grateful to them. For those of you who want to join the archive, want to hear the whole thing again or twice or three times or four times, or pass it on to somebody else, the archive will be available, I'm told, next Tuesday, November 27th, through www.pdf.org, our website. We'll send you all an email, those of you we have the emails for on this call, when it's available, so you can listen to it again. I'd like to advertise the next, fifth, I think it is, in our series for 2012-13, series of expert briefings. This next one is going to be on the very important topic of gait, balance, and falls in Parkinson's disease, and it's being led by a very well-known, very scholarly physical therapist, Dr. Terry Ellis, one of the foremost authorities in this field, sort of the equivalent, if that's possible, of Julie Carter in the physical therapy area. And she will be speaking on this topic of gait, balance, falls. That'll be on Tuesday, January 15, 2013 at 1 p.m. Eastern Time. That's Tuesday, January 15 at 1 p.m. Eastern U.S. Time. Once again, to repeat myself, please, if you haven't already done so, complete our online survey. It's on your screen. Your feedback will help us, of course, with future webinars. And to all who are in the United States, I wish a very happy Thanksgiving. And to all everywhere, happy holidays to all of you. And we look forward to you joining us on another occasion, perhaps as soon as January 15th. And a very special thank you once again to Ms. Carter for her just terrific performance in every way, both the tone as well as the content. Once again, she's a true champion and leader, and we're just delighted we were able to recruit her for this, and we all thank her. Thank you all for joining us, and enjoy your holidays, and we'll hear from you, talk to you soon. Bye-bye.